Hello, everyone. I'm your teacher Liu老师, and this is your pharmacological experimental class. And this class, we will do the lab to observe the drugs effects on blood pressure. And in your physiological class, you have studied the blood pressure, and blood pressure determined by cardiac output and also determined by peripheral resistance. Our aim of this lab, we want to observe the effects of adrenomimetic and anti-adrenal drugs on the rabbit's blood pressure. So from this aim, we can know we have two aims. The first aim to observe the effects of adrenomimetic drugs, the effects on blood pressure. And the second aim is to observe the anti-adrenergic drugs effect on the blood pressure. And this class, we will use rabbit as our experimental animal. So now we mentioned our two aims. The first aim, we mentioned adrenomimetic drugs. What's the meaning of sympathomimetic adrenal urgens? And they are semi-sympathomimetic amines catecholamines. And this drug, adrenergic drugs, can be classified according to their actions on receptor types. So we can divide adrenergic drugs into three kinds. The first kind, drugs acting both alpha and beta adrenergic receptors. The prototypical agent is adrenaline. Yes, very good. And the second kind, drugs mainly activating alpha receptors, and we call them alpha receptor agonists. We study the drug such as noradrenaline, yes, norepinephrine. The last kind, the drug mainly activating beta receptor, and they are beta receptor agonists. So, in pharmacology, we have studied the adrenomimetic agents. They are alpha, beta, alpha, or beta receptors agonists. And in pharmacology, we have known adrenaline, dopamine, and ephedrine can excite alpha and beta receptor. Noradrenaline and methoxamine, phenylephrine, these drugs can mainly activate alpha receptor, so they are alpha receptor agonists. The last kind, isoprenaline, and this one, salbutamol. Do you remember the drug? It is the selectivity beta-2 receptors agonist, and this drug, they are beta receptors agonist. This class, in this lab, the first aim, we want to observe adrenaline, noradrenaline, isoprenaline effects on blood pressure. And in pharmacology, we also study the alpha beta receptors antagonist, and this antagonist blocker inhibitors also divide into these three kinds. So, these three kind of drugs include alpha receptor blocker, such as phentolamine, trazodone, except phentolamine. In pharmacology class, we studied the selectivity alpha-1 receptor blocker. The drug is prazosine. Alpha-2 receptors blocker. The drug is yohimbine. But this drug you have studied, no use. So we don't use the drug in clinic, and it is the only the drug used in the research. The second kind of antagonists are beta receptor blockers. Beta receptor blockers, unselectivity, full blocker, such as propranolol, timolol, and selectivity beta 1 receptor blocker, such as metololo, atilolo, isololo. And the drugs, such as this one, labelolo, can block both alpha and beta receptor. We studied these drugs. And just now, we have said in this experiment, we have the second aim is to observe alpha beta receptors blockers effects on blood pyrrole. So in this class, we will use alpha receptors blocker phentolamine, and we also observe beta receptors blocker propranolol's effects on blood pyrrole. Okay, so before we study the effects and before we do the lab, just now we have reviewed adrenal receptor includes two broadly categories, and they are alpha and beta receptor. So alpha receptor, let's use the pen to explain the effects of alpha beta receptors effect on blood pyrrole. Okay, just now we have explained two adrenal receptor. They are alpha and beta receptor. Do you remember alpha receptor have how many subtypes? Yes, very good. Have two major subtypes, alpha 1 and alpha 2. And beta receptor mainly includes three subtypes. They are beta 1, beta 2, and beta 3. So now my question is, do you remember the first one, alpha 1 receptor mainly latch on, yes, very good, latch on vessel smooth muscle, and its effects, excitatory effects, contraction. Contraction means increase blood pressure. Yes, very good, increase blood pressure. And the beta alpha 2 receptor mainly latch on, yes, very good, latch on presynaptic membrane. And the major function of alpha 2 receptor is negative feedback. Negative feedback. Okay, let's review beta 1, beta 2, and beta 3, these subtypes. Do you remember beta 1 receptor mainly lies on where? Yes, very good. Heart, yes. Mainly lies on heart, and the major function on heart is the positive excitatory effects. So increase positive effects, increase positive inotropic action, positive chronotropic action. That means increase contractility, increase heart rate, and promote increase conduction. We studied the effects of beta 1 receptor, excitatory effects on heart. And just now we explained the blood pressure determined by peripheral vascular resistance and also determined by cardiac output. So excitatory effects on heart, that means we'll increase blood pressure. Yes. And the next one, beta 2 receptor. The beta 2 receptor mainly lies on, yes, smooth muscle, especially, yes, very good, bronchial smooth muscle, and the effects is dilation, inhibitory effects, dilate bronchial smooth muscle. So in clinic, we use salbutamol to treat asthma, and that also means not only can dilate bronchial smooth muscle, also dilate some vessels, such as coronary vessel. So maybe means reduce blood pressure. Okay. The last subtypes of beta receptor is the beta 3 receptor, mainly regulate metabolism and promote metabolism. So increase glucose level, increase lipophyte metabolism, and this alpha beta receptor. And just now we mentioned adrenomimetic agents. The first drug is adrenaline. Adrenaline. Okay. Adrenaline. We have studied adrenaline can activate both alpha and beta receptor directly. Adrenaline has the following pharmacological effects. Using adrenaline systemically and excite beta-2 receptor, so vasodilation. But we should know adrenaline also can excite alpha receptor, alpha-1 receptor. So predominant effects are vasocontraction. Direct activation of cardiac beta-1 receptor causes positive inotropic and positive chronotropic action on heart. So these effects also increase blood pressure. And then we have studied and we have known adrenaline can excite alpha-1 and beta-1 receptor. So adrenaline can increase blood pressure. And later, we will observe the first effects of adrenaline on blood pressure. Very easy. Now we have known will increase the blood pressure. And we also studied the alpha receptors agonist. The drug is, yes, very good. Very good. Noradrenaline. We also call noradrenaline is norepinephrine. Norepinephrine, noradrenaline mainly activates alpha receptor and weakly stimulates the beta-1 receptor of myocardium. Systemic using of adrenaline resulting in the raise of the both systolic and diastolic blood pressure, where activation of alpha receptor inducing the contraction of vascular smooth muscle. Cardiac output may be decreased because of the decrease of the heart rate via negative feedback. So that's now explained. Adrenaline mainly excites alpha receptor. So the effects on blood pressure increase blood pressure, both systolic and diastolic blood pressure. And the third adrenomimetic agent is the beta receptors agonist. The drug is the isoprenaline. Isoprenaline is a non-selectivity beta receptors agonist. Isoprenaline increases the cardiac output by stimulating beta-1 receptors. And on the other hand, lower peripheral resistance, primarily in skeletal muscle, but also in renal and mesenteric vascular by stimulating beta-2 receptors. So that means isoprenaline on one hand increase blood pressure because activate beta-1. On the other hand, reduce blood pressure because activate beta-2 receptor. So isoprenaline's effects on blood pressure maybe no chance, maybe reduce the blood pressure. So later we will observe the first aim. We want to observe the adrenaline, noradrenaline, and isoprenaline's effects on blood pressure. The first aim, and that's now we have reviewed. And the second aim, we want to observe the alpha and beta receptors blocker. Alpha beta receptors blocker, the drug is alpha receptor blocker. The drug is phenterlamine. phentolamine. So later we will observe the phentolamine's effects on blood pressure. And now we can know phentolamine can block alpha-1 receptor. So phentolamine's effects on blood pressure reduce vasodilation and reduce the blood pressure. The last one is the beta receptor blocker. Eye selectivity beta receptor blocker. The drug's name is, yes, propranolol. Propranolol can inhibitory effects on heart. Inhibitory effects on heart. So we should know beta adrenal blockers possesses negative inotropic and chronic actions and slow the atrioventricular conduction by blocking cardiac beta-1 receptor, so reduce blood pressure. And the total peripheral resistance may slightly increase initially after administration because of the increase of compensatory systemic relaxes, resulting from the decrease of the cardiac output because of the relative domination of alpha receptors. The peripheral resistance readjusts to or below the pre-treatment level with chronic use. Beta receptor blocker can reduce the blood pressure via blockade of renin release and reduction of cardiac output. So we know propranolol is one kind of antihypertensive drugs. And our second aim later, we will observe the beta receptors and alpha receptors blockers effects on blood pressure. Okay, so now let's begin our experiment. Okay, let's begin our experiment. In this class, we will use these drugs as experimental drugs. The first one, 20% urination solution. Yes, we have used the urination. It is the drug, and it is the drug anesthesia, whole anesthetics. And the next one, 0.2% heparin. Heparin is the drug can inhibit, yes, very good, inhibit coagulation. And the third one, epinephrine or adrenaline, the same drug, two names. Adrenaline is the alpha beta receptors agonist. That's now we reviewed. And the third one is adrenaline. The fourth drug, no epinephrine, no adrenaline. And that's now we reviewed. It is the alpha receptors agonist, can increase blood pressure. This one is the isoprenaline. Isoprenaline is the beta receptors agonist, and that's now we reviewed. Effects on blood pressure may be unchanged, maybe reduce blood pressure. This one is a phentolamine solution, and it is the eye selectivity alpha receptors blocker. And that's now we reviewed vasodilation can reduce blood pressure. The last one is the beta 1 and beta 2 and beta 3 beta receptors blocker. Propranolol. It is the antihypertensive drugs. So we have known propranolol later will reduce blood pressure. Okay. The experimental equipment in this lab. Later, we will use rabbit as our experimental animal. So we will use rabbit rack, rabbit table. And in this class, we will use PC-Lab biological signal acquisition system. So in your computer, you can find this system, BL420, this PC-Lab biological signal system. And three-way joint, some surgical instruments and syringes. Surgical instruments include hemostatic forceps, large scissors, ophthalmic small scissors, large tweezers, also tweezers, elbow hemostatic forceps, surgical thread, hemostatic gauze, cotton bars, and arterial clamps, tweezers, glass hook, and so on. So later we will use these surgical instruments. Okay, let's begin the lab. The first step, each group take a rabbit and weight the body weight about 2 kilogram, and then you could anesthetize your rabbit with 20% urine solution. The dosage is 5 milliliter each kilogram. So 2 kilogram we should use 10 milliliter urine. This 10 milliliter urine, 3/4 means 7.5 or to 8 milliliter为 intravenous infusion. Intravenous infusion. Intravenous infusion, and then your rabbit could be anesthetized and fixed your rabbit with a dorsal position to the rabbit rack and make its cervical part straightly and even nicely. And then we also have 1/4 urine, 2.5 milliliter. This 2.5 milliliter urine, we use the drug intraperitoneal injection. Intraperitoneal injection, we have used this method, lower abdominal cavity near the middle line, and then we intravenous inject the drugs. Okay, and intravenous using, we use the earring. Okay, let's watch the video. We have watched this video. Take a rabbit and weight the body weight. Use the razor to remove the rabbit ear hair and use the alcohol cotton. Make the earring expansion and take the injectors. We take a urine, 20% urine solution. This is 20% urine. So, do you remember the body weight of your rabbit? It's a kilogram. We give 5 milliliter. So this rabbit 2.4, and we give multiply 5. So we give 11 milliliter urine. 11 milliliter urine, about 8 milliliter. We use intravenous slowly injection. Okay, here is the earring. Okay, and the drugs flew in the blood circulation. Don't forget, slowly intravenous infusion. Because if you inject too fast and to cardiac arrest, induce bradycardia, and then maybe induce death. And the other students should use this method to observe your rabbit is anesthetized or isn't anesthetized. So in the half-life, I have explained we use 3 methods. This is the first method, and to test the eye, you can know anesthetized or isn't anesthetized. oh, it isn't unnecessary, so we should inject urination repeated use. This is the second method to prove the rabbit is unnecessary. This is the third method to observe to calculate the breathing rate. If the breathing rate is reduced, that means be unnecessary. Okay, so continuous give slowly injection urination. Okay, now your rabbit is unnecessary. So don't forget the other drugs later we will intraperitoneal injection. Okay, so and fix your rabbit with a dorsal position on the rabbit table, on rabbit rack. Don't forget, here now you can inject the drugs, intraperitoneal injection the drugs. Lower abdominal cavity, near the middle line. Intraperitoneal injection 2.5 to 3 milliliter duration. Okay, the first step, just now you have done. We wait or take a rabbit and we anesthesia the rabbit and we fix the rabbit. So let's do the second step, operation, and then separate carotid artery. This lab you have done in half life. So let's do the surgery. Take your rabbit, okay, and fix on the rabbit table. At first, don't forget fix the head. Use this thread and you fix the teeth, and then cut the wool of the cervical part. Use the razor and decisel the skin. This cup full of water to avoid the rabbit hair fly. Save the rabbit's hair off the neck with a razor. Okay. And use the cotton or gauze, white cotton or gauze. And then cut the wool of the cervical part. So let's do the lab. let's cut the skin, cervical part skin, about 5 centimeter long from the thyroid cartilage according to the antral median line. So 2 students. So who is the volunteer want to the live in your group? So you on this side and this your classmate. So both of you do the live, do the surgery for your rabbit. This is the first layer, skin. And if you cut this layer and your rabbit feel pain, you can add some maybe 1 to 2 milliliter urination and intraperitoneal injection, or use some lidocaine local administration to anesthesia the rabbit, local anesthesia. Okay. And if you have cut the skin and your rabbit no pain, so you couldn't give anesthetics again. Understand? Because the painful layer is the skin layer. Just now, we dissection the skin about 5 centimeter long from the thyroid cartilage according to the antral median line. And just now it is this is the third layer, muscular layer. And don't forget, couldn't use scissors. The second layer, the third layer is the muscular layer. You should use the hemostatic forceps to blunt this section. And after that, you could find the carotid cyst beside the trachea and separate the arteriole about 3 to 5 centimeter from the concomitant white vagus nerve with hemostasis. Okay. And then don't forget, your classmates, okay, don't forget, prepare 2 threads for you and put these 2 threads under the separated artery. And one thread is used to ligate the carotid arterial part near to the head. So tie this thread and must tie, okay, near the head. And the other thread is ready to fix the arterial cannula. And the carotid arterial part near to the heart is clamped with a bulldog clamp. Don't forget this step. Use a clamp. Use a clamp. Use a clamp. Don't forget use this part. Carotid arterial part near to the heart is clamped with a bulldog clamp. And then let's continue. Just now we have separated carotid arterial and accompanied with trachea and accompanied with this white line. This is yes, very good. It is the vagus nerve. So let's watch the video. This class we use this surgical instruments includes scissors, hemostatic forces, and elbow hemostatic forceps, surgical thread, and electronic balance, rabbit table, reader, and contents, walls, and so on, the drugs. Okay, so that's now we have done the labs. The first step, take a rabbit, and then we use urination anesthesia. So 3/4 intravenous injection 3/4 slowly injection, and fix your rabbit on the rabbit rack dorsal position. Cut the rabbit hair, and then we do the surgery for our experimental animal. So incision the cervical skin. Let's watch the video. This is the second group. Just now we watch the video is the first group to the lab. And this is the second group in your class. So, and they do this surgery very good at. Okay. And the first layer is the skin. So watch carefully and how to do this. This is the first layer, skin. And this is the second layer, fascicle. So you still can use scissors because you have seen no vascular. Yes. Use the elbow hemostatic forceps and use scissors. Cut the second layer. And then is the third layer. The third layer is the muscular layer. And in this layer have some vascular, arterial, and venous. So you couldn't use scissors. And use this hemostatic forceps to blunt dissection. Okay. So that's now. This is the second group in our class. And they separate the vagus nerve, and they also find this is the carotid artery. Okay, so you have found the carotid artery. Okay, so in our class, each group have found the carotid artery, and you have separated the carotid artery, and you have prepared two threads. One thread near the head tie, the other thread near the heart, and we have used the carotid artery part near to the heart is clamped with a bulldog clamp. Okay, let's continue. And the third step in this lab, we use heparin to inhibit coagulation. And don't forget, fill the three-way pipe with heparin. Because we know heparin can inhibit coagulation in vitro. And later, the three-way pipe will full of blood, so will induce coagulation. And don't forget, before we do the lab, fill the three-way joint with heparin. And then use 2 milliliter heparin for each rabbit. So each group, don't forget, take a 2 milliliter heparin with scalp acupuncture inject into the vein on the edge of the ear. Inhibit coagulation in vivo. Scalp acupuncture. From this step, and we change the injector into the scalp acupuncture. And this one, because later we will give a lot of drugs, so don't forget, From this step, we use scalp acupuncture. Then the scalp acupuncture should be connected with an injector full of normal saline. So let's do the lab. We take the heparin. Full of this three-way joint with heparin because heparin can inhibit coagulation in vitro. Okay. And then don't forget, turn off this three-way joint. And this is the syringe. We will inject heparin in vivo intravenous injection from the ear vein. You could fill the three-way pipe with heparin normal sodium and inject 2 ml of 0.5% heparin normal sodium for each rabbit. No matter the rabbit's body weight, each one will give 2 ml heparin and intravenous inject into the vein on the ends of the ear in order that the rabbit blood is not easy to coagulation, so inhibit the coagulation in vivo. And the arterial cannula is unblocked during the experiment. Each rabbit 2 ml heparin inhibit coagulation. Okay. And don't forget, in this step, we used this one scalp acupuncture, and later we give drugs. So after you inject heparin and change this syringe into normal saline, connect with normal saline. Don't forget. And later we will give different drugs: adrenaline, noradrenaline, isoprenaline, from scalp acupuncture, and then connect with normal saline. Okay. So now you have injected heparin. So let's continue our lab. Let's separate and insert arterial cannulation. And don't forget, cut a small incision like a V nearby the ligated part with your small eye scissors. Small eye scissors. And then insert the cannula into the arteriole towards the heart, and then fix the tube with the other thread. So cut a V incision and then insert this cannulation into the arteriole toward with the heart and use the second thread. Tie the arteriole with the cannulation. Okay, so let's do the lab. We have separated the carotid arteriole. And now, have you prepared carefully for insert the cannula? Okay, so Now we want to insert the carotid cannula, and it's a little difficult, but I have done this lab several times. So cut a small incision like a V nearby the ligated part with a keen eye scissors, and insert a arterial cannula into the artery towards the heart. So do it carefully, a little difficult, and need your team, your classmates, do it together. At that time, you should try your best to fix the tube with another thread. Okay, so we have fixed the cannula, and this carotid cannula. Just now, this three-way joint full of heparin. Later, you will see the blood eluting in the three-way joint. Okay, so let's turn on the three-way joint. Let's relax, remove the clamp. Turn on the three-way joint and regulate and remove the clamp. Okay, now you have seen the blood fluctuated, eluting in the cannula. So, oh, you have done the experiment very, very successful. And just now we have done the lab very successful, and you have seen the fluctuation eluting of the blood. So now let's turn on the computer. Turn on the computer. Let's record the blood pressure curve. Okay, so let's turn on the computer. In the beginning of the lab, I have told you this class we will use the PC lab biological system, and this is the BL biological 420 biological system. And in the model, okay, turn on your computer. Yes, you have turn on your computer. And in this ETL model, and you find the H is the pharmacology. Don't forget, we do the pharmacological lab, okay? And then, oh, this one, the term is the rescue effect of, not this one. Okay, so we observe the blood pressure. Which one is the blood pressure? Blood pressure. Here. Okay, so we find the blood pressure. And that's now, okay, we have turned on the computer. Turn on the computer and turn on the three-way joint. And we have removed the clamp. We have seen the fluctuation of the blood, so we can record the blood pressure. Do you know how to use this biological system? And that's good. Okay, so let's do it again. Pharmacology, blood pressure, and press here to baseline. Okay, to the baseline. You can find these are normal blood pressure. normal blood pressure, the blood vessel dilation, contraction, dilation, contraction, dilation, contraction, and let's record the normal blood pressure curve. Okay, so just now we have record the normal blood pressure curve from the computer, use the biological system, and then have you prepared the drugs adrenomimetic and adrenergic inhibitors? So let's observe the drugs effects on blood pressure. So following drugs should be injected after tracing a segment of normal blood pressure curve and observe the change of blood pressure curve and record the curve. So later we will observe the effects of adrenomimetic drugs on blood pressure. We will inject adrenaline, noradrenaline, and isoprenaline. Okay, students, prepare the drugs now, and let's continue the lab. Okay, take a break.